and make the investments we need to develop vaccines going into the future. And we're working very closely with our colleagues in CEPI on that. And the fund that's been launched today will cover many aspects of that, including investments in vaccine development through partner institutions like CEPI.
Thank you very much. I will read one question that I received through SMS from DPA, German news agency, our friend Christian Ulrich, who is asking for Dr. Tedros, but maybe also for Mike, what are the biggest lessons the world can learn from Ebola outbreak in Congo in fighting the epidemic?
It's difficult. Sometimes we over-extrapolate from one event to the other, and sometimes we don't learn enough lessons and we don't adapt enough. I think what we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons. But the lessons I've learned after so many Ebola outbreaks in my career are: be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
We will move on. If we may try to get NHK this time around. NHK? NHK, can you hear us? I think it's Shoko who is online. We don't have NHK. Let's move on. Chris, can we get Jeremy, maybe, who was online for some time now? Jeremy from Radio France International. And I would also, while we are waiting to get a journalist online, just to remind you that we have announced the launch of COVID-19 Solidarity Response Fund, and we have colleagues online who can speak about that. So if we should really try to use them and ask questions about the fund itself. But again, it's a press conference and journalists can ask questions they want. Do we have Jeremy online? Jeremy?
Can you hear me?
Yes, Jeremy, please go ahead.
Okay, forgive me because I have my keys right next to me, so you might hear already. I won't try today again to ask you who's doing poorly in Europe, because I know that you don't want to talk too much about member states. But can I try and ask you who's doing good in Europe regarding containment versus mitigation measures? And then I can try to get by myself who's doing poorly then.
Good. Yeah, I think you just answered my previous question. We are not seeking to identify those who do poorly or do well. We're trying to identify the best lessons we can all use, the best way to move forward together. No one has done perfectly, and no one has made all the mistakes. We share all of the errors together, so we will share failure in the same way we will share success. So if one person makes an error in a team, do you blame the person or the team? Are we a team at global level? We are. Are we a team at national level? We should be. Are we a team at community level? We should be. So we won't break from that. If we have tough discussions, we will have them directly with our member states and with those governments.
If I can add something? I'm not going to answer that direct question, but I want to say something that if there are countries that are starting to identify cases and starting to identify large numbers of cases because they're looking, because they're doing aggressive case and contact finding, they shouldn't be punished from that. It's really important that we support countries in doing the right measures, and sometimes that's going to mean that case numbers are going to increase. And in many countries, it's going to get worse before it gets better. And so I just urge everyone to take caution with that, and that these numbers are going to increase. So please look for cases, you know, please do testing, and find those cases, and so we can turn the tide.
And if you want to evaluate any institution or governmental approach, ask the questions the Director General asked. Is every member of society know what to do? Does every member of society informed? Is every health worker protected? Is every health worker know this disease and knows what to do? If you can answer those questions as a government, as an institution, as